I verified the order and the need for the procedure. I've gathered my equipment. I've identified the patient using 2 patient identifiers. I've explained the procedure to the patient. I've raised the bed to a comfortable working height, and I have provided privacy. I've washed my hands and put on clean gloves. I start to open and organize my supplies. I'm going to open my blood collection device just so that when I need it, it's open. I'm going to open my new needle-free port because I'm going to need to replace the one that's currently on the PICC line after I draw blood through it. I'm going to open my first flush, and I'm going to get all the air out, and I'm going to carefully hold the needle-free port to ensure that the side that's going to actually attach to the PICC line remains in the sterile package while I attach it to the syringe. I'm going to remove the air from this syringe, and then the first syringe that I actually use in the procedure, I'm going to remove the air also. I'm going to open my sterile 10 cc syringe so that it's open when I need it. I'm removing the alcohol cap from the PICC line, or the needle-free port that's on the PICC line, and I'm going to attach the first 10 cc normal saline syringe that I use in the procedure. I'm going to push forward a little bit, then I'm going to draw back till I see blood in the line, but not so far back that that blood enters the flush. And then I'm going to flush using a pulsating motion. So go, stop, go, stop, go, stop. With that same syringe, I'm going to pull out 10 cc's of blood. This is considered a waste because it's diluted with any fluids that were in the line. And then I'm going to go ahead and remove that syringe and attach my sterile 10 cc syringe. This is my actual blood sample. This whole time, I'm very careful not to touch the needle-free port onto anything. After I collect my sample, I'm going to attach the syringe to the needle-free to the blood collection device and put that down. And I'm going to hold the needle-free port in a way so that it's not touching the patient's arm or the syringes or anything else. And then I'm going to attach a 10 cc flush, and I'm going to flush using a pulsating motion. This first 10 cc's that I flush after the blood sample is collected has the old needle-free port on it. So as I remove that flush, I'm removing the old needle-free port, then I'm attaching the second syringe with the new needle-free port, and I'm going to flush using a pulsating motion. After I flushed, I'm going to clamp the line, remove the flush, and attach a new alcohol cap on there. After I've done this, I'm going to get my 10 cc syringe with the blood and the blood collection device and attach the vacutainer to it. And the suction within the vacutainer is going to pull out the appropriate amount for that blood sample. I'm going to get all my trash and throw it in the trash. I'm going to throw my blood waste and any blood that's left from the sterile 10 cc syringe in the biohazard. I'm going to throw my blood collection device in the sharps. I'm going to appropriately label